Ask folks if we can do the Pledge of Allegiance, please.
Yes.
Pledge allegiance
Allegiance to the flag
of the United
of the
States
States
of
of America,
and to the
to the
republic
republic
for which it stands, one nation,
nation,
under
under
God,
God,
indivisible,
indivisible,
with liberty
liberty and justice for all.
all. And if I have somebody who is willing to move to approve last month's minutes.
I did read them. They're fine.
You move to approve?
I'll second Jane's reading them.
By acclamation, can we approve the minutes of last month's meeting?
Yes.
Approved, okay. And then the next item on the agenda is our health officer's report. So let's turn that over to Marie, if we may, Marie.
Sure. Okay. Good evening. I'll keep it short because I know you guys have a presentation to get started. So I'll just sum up a little bit of what we've been doing. So our food license renewals are just about complete. Just about everybody has submitted everything. We're just waiting for a few other ones. There's some delays with the mail and you know, our lobby protocols and things of that nature, but they're almost complete. Katie and I are continuing to assist residents who call into our office, into the township. We're assisting them with registering for the vaccine for, you know, Delaware County. We answer a lot of their questions that they have as far as, you know, the vaccine itself and, you know, where the provider locations are. Our staff protocols for the township building have been extended now through the end of March. I believe it's the 26th. So our windows are still down. We're still providing all services throughout the township, but we are doing contactless services. So we're still utilizing the lobby area. You know, we put up plexiglass to keep minimal contact between the customer and our staff, and we're using the drop-off pickup boxes for exchange of paperwork and things and checks and things.
What's the next date when a change in status might occur?
So we're going to review the protocols, I believe March 23rd. They're extended through March 26th. Yeah.
So on the 23rd, you'll evaluate the data, and if the data support an advancement towards a more open process, then 26 would be the date.
Correct.
Okay, thank you.
Yep. Katie and I are and OEM, we're still continuing to review the federal, state, and county updates. We provide this information through our, you know, to our residents through email, posting it on all our social media sites. As soon as it comes into us, it goes out. We also, Katie and I, stay in close contact with the restaurants. So everything that comes through, you know, we send out through our very large contact list. So the information is getting out there. We're still continuing. OEM is still continuing to track COVID cases in our local colleges, which you were made aware of about 2 weeks ago. It looks like Villanova's cases are starting to come down. We have not seen much activity with the other local universities and colleges.
So how long is the list of local universities and colleges?
So we track or reach out to Villanova, Cabrini, Eastern, and Valley Forge Military Academy. Yeah.
Okay. And do the other three, so we'll talk about Villanova, do the other three have the same level of quality in their tracking and control? Are their campuses open? I guess would be the first question, because you wouldn't need all that if the campuses are not open.
Yes, so their campuses are open. They do not, from what we can see, they do not have the I guess in-depth and sophisticated tracking and surveillance and contact tracing, you know, that Villanova has, you know, which is why we're seeing so much activity over there. Active cases are very, very, very low in the other universities, and you know, I'm sure that has something to do with it. So, so no concerns. Their quarantine buildings are not full. And, you know, we've reached out to them on a regular basis, probably every 3 weeks.
Okay.
So, and then I'll finish up by saying I'll look into those two things that Dr. Duman had brought up as far as openings for the Board of Health, and also that Kathy brought up, which is updating our website. So if anybody goes there, they'll see that we have some openings. Thank you.
Thank you. So our next agenda item is old business, and I think that there is no specific open item except the items related to the board, the county board, and COVID. So the remaining business of our meeting, in addition to the work that our interns are doing, will be covering off on I would rather call it ongoing business than old business. So so the next item then to cover off on is the student interns, and I'll turn the microphone over to any one of the three individuals involved there who might want to take the. You're muted, Jane. Still don't hear you. Anybody else hearing? So it may be muted in Zoom, and it may be muted on your machine. There you go.
Yeah.
Oh, had you and lost you.
Yeah.
There you go.
Well, I can just speak to the interns, and maybe they want to give a little bit more background into what's going on now. They've basically come up with a survey. They're getting permission from the school staff to administer to the different grade levels. So I don't know, Tricia or Suman, if you want to kind of just speak a little bit more about that.
Yeah, so over the past month, we tried to first get in touch with Dr. Kearney, who's the Assistant Director of Teaching and Learning, and we didn't receive a response from him, but we did get a response from our principal, Ms. Kafkas, and she was definitely in support of our project with like all the mental health awareness that Radnor has been doing recently. And she recommended that we get into contact with Dr. Bechtold, who is the Director of Teaching and Learning, so that he could like look over our survey and share it with the school board, and then so that we could possibly present our project and get it approved so that the students at Radnor could take it. And we wanted to do a survey because at the beginning of our project, there were some concerns over whether our project is even necessary and applicable to high schoolers. So we just wanted to get a voice from the students and ensure that our project is actually needed. And if that doesn't work out, we're going to try to shift our project to doing research from journals online and present a case for why mental health education should be reformed rather than trying to conduct these surveys.
Okay, so do you have what you need to continue to move forward on this then? Excellent. Lisa, Jane, anything else from you on this?
And do you guys need any help from any board members? Are you guys good with your literature search? And
we were wondering if someone could look over our questions for our survey before we send it off to Dr. Bechtold.
Yeah, I did actually have a chance to take a look at it. I will send you guys back some thoughts about it.
Thank you.
there you go. Just guys got to ask and we shall help you out.
Excellent. So anything else on that? Okay, the next agenda item is public participation. Marie, we're not expecting any other than our guests from the county. We're not expecting any public participation, right?
Nothing has come in so far, correct?
So that, well, this is going to be a speaker forever hold your peace on that one. So I'm going to make a suggestion that we switch the next two items, that we go ahead and allow our guests to go now and do our COVID updates right before adjournment, so that we can be respectful of the time of our two guests. So unless there's an objection from the members of the board, I'm going to ask Dr. Taylor and Grace to go ahead and again, thank you for coming and joining us to update us.
Yes, well, thank you for having us today. I'm Monica Taylor, Vice Chair of Delaware County Council. Thank you all for joining us. And some of you may know that Council has been working towards the development of a county health department. We began this process in January of 2020 and have been working with the State Health Department, our Public Health Steering Committee, and our County Strategic Planner, Grace Gorenflow, who has joined us here today. And we have completed several milestones, including a health analysis of the county, a strategic plan for our health department, and we have also opened a community wellness center in Yaden, which will serve as the hub for our health department in the future. Currently, it's serving as a vaccine location. We are now at the point in the process where we are looking for input from stakeholders in the community as we begin to build the programs that reflect the needs of Delaware County. Today, we will begin by giving a brief presentation on the health department and a timeline for implementation, and then opening it up for a Q&A session to receive input from you on how and where you see the health department fitting into the county and in your community in particular. So with that, I will turn it over to Grace for the presentation.
Great, thank you. And I'll just echo Monica's gratitude for the opportunity to meet with you all. Clearly, you have a very robust Board of Health, and you're engaged in public health in a way that a lot of other municipalities in the county are not. And, I anticipate that this will be the first of probably several conversations that we'll have as we move forward to make sure that the transition, especially when it comes to environmental health services, is a smooth one. And I want to thank Marie for spending a few minutes with me this afternoon, giving me a little bit more information about you all. So I am going to talk for just a minute about the health department, sort of in a larger sense. And I want to just start by, first of all, acknowledging it. You do have a lot of great work going on in terms of raising awareness around public health issues, as well as the number of inspections that are done in your part of the county. And so I just want to talk a little bit about how the county health department's purview is even wider than that. It will include environmental health, but it's even wider than that. And very simply put, the mission of the health department is to make Delaware County a healthy and thriving community. And that means that the health department not only is going to work on sort of traditional public health services that we'll talk about in a moment, but also it's going to be really important for the health department to develop and maintain relationships with organizations in all different sectors all across the county, because having a healthy community takes an all hands on deck kind of approach. So when we think about health and think about what it takes to have a healthy community, it requires all of these things. And the health department is not going to, with the exception of environmental health services, it's not going to take over any other programs. Rather, in addition to doing some additional data gathering and analyzing, we're also going to be doing a community health assets inventory, which we're doing partly through these kinds of conversations, just so we know like where what coalitions already exist? Where should the health department be at the table? Where isn't there a table where there should be one in order to address the health concerns of folks? And how can we best partner with the organizations that are already involved in these various foundations of community health? So that's sort of at a high level, I would say, what it is that the health department will work on. And then I just want to share with you a few findings from our initial data gathering and some of the first priorities that have bubbled up and risen to the top. So the first is the fact that, like most places across the country, there are tremendous disparities in average life expectancy throughout the county. And that tells us that the foundations for community health are not present consistently across the county. So there's an almost 20-year difference in terms of the high and the low. And the high that you see is in Concord, and the low that you see is in Trainer. And there are a couple of other current inequities to raise as well, just so you have a sense of some of the priorities that we're starting out with. And these data also just show the importance of really making sure that the health department takes a deep dive into data and doesn't just look at what's going on county-wide. And these are data that were readily available. But as we move forward, we'll be doing a lot more data crunching and understanding better what different health conditions look like in different townships, or by zip code, or by census tract, or however, the lowest denominator, the lowest level we can find the data in. And then finally, the last one that we're sharing with you for the purposes of understanding inequities has to do, as you can see, with firearm fatalities. And a big part of the health department's work is going to be addressing these inequities. Now, we're showing you health disparities, which are the simple differences in outcomes. Inequities are differences which are unjust, unfair, and avoidable. And so the health department will be very focused on addressing the avoidable causes, the underlying causes, and that has to do with unequal foundations of community health. It's going to be a big part to make sure that it doesn't really matter where you live in the county, you have an equal access, equal opportunities in terms of health, that's a long-term vision and goal. So another way of looking at the, oh no, did I do this the wrong way? I did, sorry, let's start there. Another way of thinking about health priorities is to look at the top 10 causes of death. And what we can see here is that if you divide it by race, that the top 3 causes are equal between the white and the Black population in the county. But if you look further down, you see that when it comes to the 4th cause of death, it's assaults. In the Black population, it doesn't even show up with the white population. It's actually number 20 with the white population. And other than this difference, I think there's one other difference here. There's only one thing that doesn't show up for both. Oh, it's septicemia, and that's next on the list for the Black population. So, there are, it's fair to say, I think that all of these, everything on here is a priority. A lot of these are chronic diseases. Most of them are chronic diseases, and you all are aware of those, just given the kinds of information that you provide your community about various chronic diseases, as well as some other acute things that I've seen. And then finally, here are the last 3 issues that have risen to the top. The only one that might be surprising to you is STIs, the first one on here. We're seeing continued, like an upward trend of chlamydia and gonorrhea infections. Otherwise, I would say that with the opioid epidemic and even before the pandemic, mental health, and having a sufficient number of mental health providers has been flagged as a priority for the county. So in terms of the timeline that we're looking at, we are in the process of selecting the Board of Health. And from now through the end of the year, we'll be working on establishing the programs, continuing to reach out in the community to get feedback and have conversations and dialogues and learn what we can from you. We'll start to hire folks, hoping to get the health director hired in May and then kind of take it from there. And we anticipate launching the health department in January 2022. We're working closely with the state to make that happen. And I'm also going to just say, again, Marie, thank you for agreeing to really help out when we begin our work, which will be soon, with the health officers to make sure that we get the best advice possible in terms of how to move forward. That's it in a nutshell in terms of what we wanted to present to you. These are called listening sessions because we really want to hear from you also. So all of these questions here are fair game. You know, happy to answer any questions that we have, and we'd really like to know what you think we should know. And also what you see as health priorities, given what you all know about your township, as well as your initial ideas about collaboration. So with that, I am actually going to take this down just so I can take notes. I only have one computer, so I don't have an extra screen here. So anyway, let me open the floor to your questions and to your comments. And what would you like to talk about? What would you like to tell us? What would you like to ask us?
I can't hear me.
We
Yeah,
can
you're
hear
good,
you
Jay.
now.
Oh, you can
Hear
hear
you
me?
now.
Yes, yay. Okay.
My question is, how do you see the Radnor Township Board of Health supporting, working with, integrating with the Delco Department of Health? And are
So,
other
go ahead.
townships involved?
Okay, and Dr. Taylor, would you like to start or would you like me to?
Well, you go ahead and start.
Okay, so I love that question. I would say that, quite frankly, that is one of the reasons we're having these listening sessions. We have not started, we have not had any internal conversations about what we see happening along those lines. And so I'm going to unless Dr. Taylor would like to add something, I would turn the question back to you and say, what do you think? What do you think would be appropriate? What would you like to see? But before I do that, Dr. Taylor, what would you add?
Right, that's similar to what Grace was saying. This is one of the reasons why we wanted to have these sessions so early on in the process, to kind of talk to you about how you think we can collaborate best. Now, there are specific areas that we would be doing as the county health department once we're approved through Act 315, but there's other areas that I think that we can collaborate. And Radnor is very unique because there aren't really any Board of Health, Township Board of Health in the county besides Radnor and Chester. And so when you think about it that way, like we want to work with you to figure out what you're doing, where you think we could collaborate, where you think we could help you and provide more resources for you and what you're doing in your community, and kind of go from there.
Well, I think that Delaware County has such a varied number of communities, and we go from the very wealthy to the much needed communities. And I think that is very difficult to work with that. I think each township represents unique experiences that would be important to share with Delco. But I don't think it would be Radnor Township alone. I think we would need all the other townships to work together to share their issues, their concerns, their problems, their wins, their losses with Delco. And maybe it would be a good thing if Delco kind of had townships become part of, even if it was a commissioner of a township, become part of the Delaware County Board of Health, and all, because you can't see it all. I mean, what's going on in Trainer is very different than what's going on in Wayne. What's going on in Chester is very different than what's going on in Yaden. So I think it would be really important to get input from as many communities as you possibly can, given the fact that we're all very, very different.
Yes, and that is part of the process. So that's what we are doing. We are reaching out to every single community. And we've already met with all of the township managers
Good.
once, and then we're having another meeting with all of them again in April to talk over some more logistics. And we're also meeting with all the municipal elected officials too, just to kind of talk a little bit more about their communities and get more perspective from that, from kind of that aspect of it.
So I have a
And
couple
then-
of questions. Oh, I'm sorry, Jane.
Oh, yeah, just really quickly, I was just going to add to that. We know that once the health department is established, it is going to be important to continue to have a venue to get input. That's going to be a big role of the health department, to stay in touch with the community. And when, even when the health department is, doing a thorough needs assessment, when they're establishing programs, as issues come up, the health department not only will be working to understand the data that are available and consult whatever scientific evidence is out there, but also they'll be continuing to get information from the community, on the ground to understand not only the health issues, but also the best way to address them. So we don't know exactly what that mechanism is going to look like once the health department is launched, but there will be one.
So I'd like to ask a couple of questions about how we got to where we are. What are the organizing principles? So, for example, does the state have any requirement for counties to have a board of health? And if they do, is there any consistency? Number two, you are hiring into a board of health. Where did the enabling legislation come from? What is the structure of that board of health, and what will the funding of that board of health be? And what is the remit there? So that obviously you've told us that Radnor is the only township that has their own township board of health. So Chester,
Radnor and Chester, yeah.
but isn't Chester County?
No,
No.
it's in Chester.
City of Chester.
City of Chester.
City of Chester. Okay, but that won't fall under the Delaware County Board of Health, will it?
Yeah,
Oh, okay. Sorry. All right. So there are two out of how many townships? 30 something?
49. There are 49 municipalities.
49.
So a township structure can't be the foundation for a county board unless we build that out, which is an interesting proposition. So first, let me ask those organizational, foundational, and funding questions, if I might.
Yes, so
So-
I'll start, and then Grace, you can take over from there. So the state requires specific guidelines for a county health department. And so those are governed by Act 315 in the state guidelines. And so in order for us to establish our Board of Health, we had to have preliminary approval. We had to have approval of our certificate of approval from the state. So we received that in January. Once we got that approval from the state, then the county council had to have a resolution to establish a Board of Health. Now, the Board of Health does have specific guidelines that are dictated by the state as to what it oversees in terms of the county, and also to what makes up the Board of Health.
So the state has
in-
rules, but they didn't have a mandate to have one. Otherwise, we wouldn't have gotten to a year into the epidemic and not had a county board of health, right?
Well, that's because we don't have a health department. So they don't have a mandate that every county has to have a health department. And so, but anybody who is going to have a health department has to have a Board of Health. Our Board of Health works with the director, the medical director for the county's for the county health department. So we have never had a health department before.
Right. So the state has been administering its entire COVID program through the county system, and yet we had a state that did. We have a county that didn't have a Department of Health or a Board of Health.
No, so the state hasn't
Right.
been administering its COVID response through the county in that way. So the state administers its COVID response to all of the other counties that do not have a health department through the state themselves. And so originally we sat underneath of that umbrella, which is 54 counties within the state that would have been fallen under the state umbrella. Early on in the COVID pandemic, the county council collaborated and made a memorandum of understanding and agreement with the Chester County Health Department in order and asked them to be able to take us on for COVID response. And so the state now works through Chester County's Health Department in COVID response with Delaware County. And so those are almost two different kind of paths. Right now, we're on a different, our health department is almost separate right now from our COVID response because it is in the infancy stage of program development and is not fully approved yet. And so it won't be fully approved until next January.
Got it. So my question is, do you see any foreseeable stumbling blocks in this process for the next year? Is there anything you're keeping up at night? Is there anything you need help from us with this process?
Well, I mean, the stumbling block could be COVID. Of course, you know, the state is very occupied with COVID-19,
Right.
trying to keep this on track. And we've set a really aggressive timeline. Typically, it takes at the minimum 2 years to implement a health department because of all the regulatory pieces of the puzzle that we have to put together in order to gain approval from the state.
Mm-hmm.
And so as long as we can continue on the same timeline that we've been working on the last year, it's doable, but it is a really aggressive timeline. But the state has looked at it and they think that we are on track to do all of that. And so we've been we actually meet with them monthly to go over the program, so the specific program areas. So we meet with the state, we talk about one or two program areas, and then we meet with the specific individuals at the state who currently do those program areas for us in order to make sure that we are taking over all of the things that we need to take over once we become official next January.
Got it.
And Grace could talk a little bit more to that part.
Well, I love that question, Kathy. And I have to say, I'm amazed at how smoothly this has gone. The biggest stumbling block we had initially was sort of getting an audience with the health department, because understandably they were overtaken by events. The county had started routine calls with them, and then the pandemic hit.
Right.
And so now that we're back with that, they are amazing. They are working with us hand in glove. They are getting all kinds of information. They're connecting us with people. They're really excited. They're very supportive. And so, yeah, barring whatever the pandemic's going to throw at us, and hopefully that's going to be it in terms of public health emergencies, got to be said.
I mean, our information, I'm sure Marie has told you, is coming from, of course, public participation or anything that fed through Marie, and then the Board of Commissioners, we're their advisory panel. So that's kind of how we handle business pre-pandemic. So is that the structure you're looking at for our township? Would that feed into the county at that kind of level? With our town needs a voice as well, as long as all the other 54 townships in the county, or however 39, however many they are.
Right. And that's part of what we're figuring out.
Got it.
We've started, I'm sorry we don't have a better answer for you at this point,
right.
but it is going to be a two-way, I mean, it is right now, a two-way conversation. What it is that the health department, just to make sure that the townships and the county both have what they need to ensure that health departments is effective.
Annie, are you on?
Got it.
Let me get her. I'm in the middle of a call.
Uh-oh.
Oh, I thought there was a question there.
Yeah, so I suspect, the two organizations that you'd be speaking to, our needs in our township are very different from Chester. So I think it's actually kind of convenient that the two Board of Health that exist are in two very different communities. So kind of getting feedback. I mean, I think in Radnor, our concerns are public health concerns. I mean, obviously COVID, but other things we've been talking about, substance abuse and mental health, as you've heard, like the students are doing a report. Our report last year was also kind of on mental health in students. And so those types of health issues are, obviously high up in our community, which which obviously it's going to be different than in Chester. I mean, still just as important, but different. I don't know what our STI incidence is around our area. We have a lot of colleges, so, but something to look into.
I think it's a great call. Oh, please.
Okay, I was just going to reiterate that or mention that we are, I'm so sorry. I've been on several calls today with people in the county. I don't think we mentioned the interns that are going to start working with us. We have a student from Widener and a student from Temple, doctoral students who are really interested in getting academic credit for doing some work for us. And what we're thinking about is having them do a lot of data crunching. And one of the things that is going to be really, really important is to get our hands on the differences, to get the quantitative information, by township, by zip code, by census tract, because that is going to be instrumental, I mean, critical to developing programs that meet the needs and kind of understanding where various efforts need to be. I mean, physical activity and nutrition and those kinds of things, likely countywide. Violence prevention, not so much. It could be that STIs, we'll see, when we take a closer look, they might well be concentrated in the areas of the county that have the most college students. So, your area with your colleges and universities, where Widener is, where the community college, who knows?
Those seem to me to be the kinds of problems that should be countywide, because they cross township lines, they cross county lines, and they're akin to one of the other major issues that we've discussed since I've been on the board, and that is environmentally insects and pathogens, mosquito-borne diseases, control of mosquitoes, and control of pathogens that the township has an interest in, but doesn't have the capacity to manage. It's a broader management problem than that.
Well, and that will be a difference between what as I understand it, and I'm still learning, but I think that's going to be the difference between having a health department, a county health department, and not having one, is that environmental health won't solely be based on the inspections that are done, because right now, I mean, that's the focus, right? Because that's what's funded. However, once we have a county health department and there are other elements we can bring in, there will be a new way to consider environmental health programs and environmental health problems. And, we don't know exactly what that's going to look like yet, but, I think, and I don't know how much lead poisoning is an issue in your township, but that's an example of where then you want to look at the housing stock, or rates of asthma. Then that's another thing you want to look at, particulate matter in the air and, those kinds of things. Again, this might not be specific to your township, but I'm sure that there are things that are. And to your point, Dr. Simmons, you're right. Public health issues don't respect political boundaries. So there is, to me, that's another benefit of having your own health department. Now, things aren't going to stop at the lines, it's not that anything's going to stop when it gets to Chester or Montgomery or Philadelphia or, Delaware, but at least when it comes to things that involve different townships, where things are kind of leaking across borders, there'll be, the health department's an entity that can view things and approach things from that kind of a perspective, that kind of a basis.
I actually have a little suggestion based on your slide program. One of the first slides you showed was a pretty substantial differentiation ethnographically on child mortality. But then you went down the list of mortality, and I might suggest child mortality is something that we all, I hope, all care about. But since children die a whole lot less frequently than adults and elderly, the noise to signal ratio on the list of 10 most common causes of death might have drowned out disparities in causes of death that would be affecting child mortality. Because if child mortality is a small fraction of overall mortality, then significant differences in causation in child mortality might be lost in that chart.
Absolutely. I couldn't agree with you more. I think that's a perfect example of where we need to dig in more. We need to understand not only the causes of death, but precisely where they're occurring. Otherwise, we wouldn't know how to go about that. So thank you very much. I think that's an excellent point.
I just have a simple question. What was the rationale behind choosing the Yaden site versus having the offices in media?
So our goal for our health department is we are working with more of a health 3.0 and foundational model of a health department. So the Yaden site it's not a large brick and mortar health department. So it's a smaller health department because our goal is to have a health department that's a little bit more mobile. And so we're going to have more satellite locations around the county versus one big giant location. The Yaden site was a good start because we have a large portion of our population that lives on the eastern side of the county.
Mhm.
And so when we're talking about a large portion, when you combine Upper Darby, Yaden, Darby, Sharon Hill, all of those areas, that's about 125,000 people that are in that eastern quadrant of the county. And we also wanted it to be accessible by public transportation.
And what's the total population of the county?
The total population, 560,000.
So about a quarter, a little under a quarter is in that one stretch along the eastern boundary.
Yes, that one section.
Because I volunteered at the Yaden site doing vaccination, and it's small. It's a small
Yes.
facility. I would say tiny. But
yes, because our
yeah,
goal is to have a
it's
smaller footprint and then to be able to be more mobile and have more of those satellite locations. Even some of our discussions that we've had with our colleges and universities, I know that the community college along with Widener would like us to also have a location within, like
nice.
to serve the community, but a location on their campuses.
Wow.
And so that's the kind of different thinking that we're going with our health department, trying to be as embedded in the community as possible.
That's great. That's a really great idea.
Marie, you're muted still.
Sorry, I wanted to jump in real quick while you were talking about those sites, because that seems to be a big topic here in the township building. So it looks like you're going to start with this Yaden site at the beginning, at the initiation of the county health department. Is there a timeline when some of these other satellite sites might open up, or do you have a certain set ready to open up shortly after at the same time, or are you sticking with this one site for a while and kind of going from there?
We haven't built out the timeline on our satellite locations, but that is something that we would be talking about fairly early in the process. And as I said before, we will be hiring, or actually Grace mentioned it, we will be hiring a director for our health department in May. And I would assume that more of that logistical piece will start to form that once the health director gets in place.
Thank you.
Just to kind of confirm some of those MOUs that'll need to take place with the community college and Widener and other locations that we might be looking at for satellite.
And some of the satellites might be one desk.
Yeah, because you
right? I mean, I imagine they will take various forms.
Because will you continue to use Yaden as a site for vaccinations, for the foreseeable future?
Yes.
So you might have the one desk.
Yes, but the second portion, since you've been at the site, you know how the first portion is set up for the vaccine, and then there's the second portion in the back.
Right.
That'll be built out this summer, and that'll be more
Oh, good.
more clinical space.
Yeah, good.
Then Chester, there's a vaccination site opening in Chester.
That's this week.
Yeah.
Yep,
Yes, Keystone Wellness.
yep. And then Aston and,
In Springfield Hospital.
yeah, in Springfield, they're opening up.
Well,
Good.
thank you. Are there other questions from the board? Charlie, you're muted. We're not hearing you. I don't know if
Yeah,
you're muted
you're
or not.
right.
There you go.
Okay.
Just out of curiosity, where are you in the hiring process? If you're planning to hire somebody by May, would assume that requirements and duties and all that stuff have already pretty well been spelled out in the beginning. You're in the process of recruiting, but
Yes, so the requirements have been spelled out. One of the jobs of the Board of Health when they are appointed is to hire the director. One of the things that council has done is we are going into an agreement with a firm to actually do a national search for our health director. And so they are starting that process so that it'll all be kind of, the process will have been started by the time we appoint that Board of Health that will be starting mid-March.
okay. Thank you.
Now, maybe I missed this, but do you have an advisory board of volunteers that will be part of this?
Yes, yes. And so right now we have a steering committee that's been working for the last 9 months, kind of helping to push this project along with Grace in our strategic planning process. And so they've been working with us. They're the ones, we are the group that is going through the Board of Health applicants, and then County Council will appoint the Board of Health, and then we will move forward with the process of recruitment and interviewing for that health director.
Good.
And I just had one more thing to add. As I said, you know, we will be working with you all moving forward to make sure that we have a smooth transition, to make sure that, you know, it would be great to, when we're looking more closely at communication, venues and that kind of thing, make sure they're mutually acceptable. The other thing is that in addition to holding these listening sessions where it's kind of, you know, wide open, we're also having sessions we're calling think tanks that are going to be program specific. So for example, we're starting with the maternal and child health program, and we've got several. In fact, do I have time, Dr. Simmons, to share my screen and show the list?
Of course, please.
Okay, terrific. Hang on a second. And let's see, minimize that, and here we go. Okay, so the list continues to grow based on our listening sessions. I think we might have a session on seniors, but anyway, this is the list as it stands right now. And if you would like to sign up to participate in a think tank, you can sign up online. I just want to make sure really quickly through a series of screenshots, you know where to find us on the Delco website. Last time I checked, the icon was on the second line. And if you click onto that icon, it brings you to the health department creation page. This is what the top of it looks like. A lot of other information on here, but if you click get involved, it brings you here. You can see this is where you would sign up for think tanks. Okay, hopefully, and this is all hopefully very user friendly. You can sign up for ongoing updates as well. And this is the email to use. It's down here too, but this is bigger. So I just wanted to be sure that you all saw that and really encourage you to participate in the think tanks as you see fit, as per your interests.
Great. Thank you for sharing that with us. That was really important.
So I'm going to suggest that, is there a time where we should circle back and talk with you again in a quarter? Because I think this was very helpful for us as we go about reorganizing our efforts for the township, and you will probably be moving quickly and substantially changed. Could we ask to invite you back at some point, say before the summer, before schools break for the summer, some time frame like that? 3 months from now would put us in May. Or should we have you back before that? Or do you not want to come back and see us at all?
We
No
won't take
such
it for
luck.
ourselves.
Adios.
I think
How about if we work to put you on our schedule again sometime downstream? Would that be good?
Yes, that would be great. I think maybe your May meeting might be a good timing for us to come again.
A quarter from now, yeah. Excellent.
Thank you for having us.
Thank you for your
Thank
time.
you.
Thank you
Thank
for your
you for
patience.
sharing.
Really appreciate
And
it.
we'll look forward to working with you. I think that this is actually pretty invigorating. So thanks a lot.
Thank you. Enjoy the rest of your
Thank
meeting.
you.
Yeah.
Thank you.
All right.
Everybody.
As for the rest of our meeting, I had only had one question on the COVID update, and I don't know if everybody else had a chance to review the materials that Marie shared with us from Villanova. But my question on that was, it was slick and polished and good content and good user interface, but I couldn't figure out where the positives who need to be quarantined are being quarantined. And from my point of view, from the township point of view, it's great that they're protecting the campus, but the campus from the township point of view is the potential hottest source of township ugliness. And I couldn't figure out how they are protecting the township from their quarantined folks. Marie, could you figure that out? Is there a site where they all are? Are they going to the Giant? Are they going to the Acme? Are they going to the open stores? And if so, what can we do to protect ourselves?
So that was the concern, our
Yep.
community. So that's where all this kind of stems from. If you go, I think I provided the links, but if you go
Yes.
to the website, so the students who are, I guess it's 300 miles is their cutoff.
Right.
Those students who are positive, they have to go, like they have to go home.
Ah.
The other ones who are going to stay in their designated quarantine spots, whether it's off campus or on campus, Villanova has stated they have, a very strict enforcement rule, and everybody was notified about it. The parents were notified about it. The students were notified about it. The staff is encouraging it. All the staff at the health center are encouraging it and enforcing it. And there are some pretty significant, punishments for these students who do not follow the rules. So they really wanted to put that out there and let us know.
Good.
Now, if you watched we're watching our township numbers too. And as you can see, they're holding steady. I mean, we've been one of the, I think 4 lowest in the county. So everybody's watching it right now. Chester County is involved with them on a regular basis, as is the Department of Health. And they're saying, keep going, stay the course. So that's kind of just to answer your question.
Short of house arrest ankle bracelets, they're doing as much as they can.
Yeah.
But I guess Father Peter did put the lockdown on.
They
You know,
did. Yeah.
The timing of that is questionable, but they put this whole campaign together, and they've really emphasized how they're taking this very seriously, and letting the students know if they don't follow it, school's going to close and you won't even have the option. So that's how that is at this point.
Anybody else have anything they want to?
No,
Well,
I mean, I live next to the campus and we get emails about all this stuff. And there's a dashboard they sent us. Yeah. So we know as soon as it hit, we knew what was going on. Like, what happened? Kids are back. There's a COVID cases going up. Yeah.
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 And you can see the
Heard
rate-
right after. Sorry, Marie. I was going to say, it seemed like it happened right when the kids returned.
It absolutely did. Yep. As soon as they got back, week later, cases spiked. Yep.
So they anticipated it, as you could see from their response. They didn't anticipate it happening quite so early, but they fully anticipated this spike. And I guess the last, I think 4 or 5 days, it's gone down dramatically. The daily cases are down. The active cases are down significantly. So
Excellent.
Just, I volunteered on Monday for the county, and there's a real issue with quantity of vaccination available to the county. We're not getting the doses that we should be getting. So there is a lot of frustration about getting the vaccine out to the community. And, we have several sites ready to rock and roll, but we can't use them, or we can use them only minimally because we don't have enough vaccine. So, our communities are very, very frustrated. People are like trying everywhere and anywhere to get the vaccine, and it's just not happening. But hopefully, in the near future, we'll be able to procure a lot more vaccine, and we'll be able to do a lot more vaccinations. And I also want to point out that Delaware County has the most volunteers, not only in the country, but in the world.
Wow, nice.
To do this COVID vaccination process. So it's pretty amazing.
Great. And that's congratulations. I think by the time we meet it right now, the vaccine supply everywhere is an issue for everybody.
Yes.
We are rationing a precious healthcare commodity. I believe by the time we meet again next month, that is likely to look very different. And I don't think
I hope so.
I don't think there's going to be surplus, but I think a lot of these issues are around the very scarce. And I think that nationwide we're starting to settle into a better sense. And I think that all of the companies are ratcheting up in collaboration with the federal government to increase the supply, and it was going to increase anyway. So hopefully next time we meet, the frustration level will decline.
Hopefully. Yep. Hopefully.
So Jane, do they need more volunteers if they open additional sites? Or are you guys well resourced?
No, they can always use more volunteers.
Okay.
But we do have a lot. On occasion, they will use agency nurses to help
Okay.
the vaccination process. But it's going to also depend on the number of sites open at the same time. Aston's is open, Yaden is open, and Chester's open on a very limited basis based on the amount of vaccine we have. But the more sites, the VPODs as they call them, that open, the more volunteers we will need.
Okay. And Marie, did they ever open that hotline for residents to call?
they did.
It's
Okay.
problematic, though.
Oh, it is okay. She says with hesitation. I mean, I'm online. I get an email every Friday saying stay in line, and they give the dosing, what they've asked for. Yeah, they've asked, I think last week they asked for 9,000 vaccines and they got 4, something like that. So they always get less than that county's asked for. But every Friday get new numbers. Keep waiting. Pretty much. So.
Right, that's the board. I know Montgomery County is, anxiously awaiting them too. So
Yeah.
So may I ask for a motion to adjourn?
I will motion that.
Seconded?
second,
See you all next month.
All right, and excuse me, I apologize.
That's
My
right.
brain was
It's-
somewhere else.
It's
Thank you, Marie.
understood.
It'll be
Thank
Monday. It'll be
you
Monday,
for
Mark.
joining us and forming the quorum. We appreciate it.